That reminds me of talking about getting the prostate exam, and then the urologist cleaning up after the. Remember us talking about that years ago? How you didn't you have a prostate exam with somebody after they checked your prostate? They kind of wiped you up and cleaned you up for you.
No,
do you remember that? Do you remember
so
that
tender.
No,
we talked about that years ago. No, I know you didn't do it.
Here, you got to learn this. You got to learn this phrase. You ready?
Yeah.
不，谢谢。
Boo shishya.
What's that mean?
That means no thank you.
No, thank you.
Right.
Shisha.
Shishya is thank you.
Yeah, I
and
know
boo
shishya.
is no.
Okay.
Or you can say boo how. Boo how. Boo how means bad. Boo how.
不，
Boo how.
谢谢。
Boo how. Boo how.
Okay.
Boo how.
Boo how. Boo how.
So you can go back. Now you've
Okay.
got, now you can set boundaries.
There we go.
Boo how.
Thank you.
Boo how. Bad.
I'll just keep my Google Translate on the table.
Boo how. Boo
Yeah.
how.
Can right? Can you put my underwear on, please?
Would you mind sliding my panties back up?
Back up. Thank you.
Oh my
Oh,
god, that was
man.
so weird, man.
It was a lot.
That is. So
I have to say I didn't enjoy the rest of the massage.
No.
No, you must have
Oh,
been.
hell
What
no.
happened after that?
I
You
was-
probably don't even remember.
I was pretty mortified the whole time. Yeah.
So much for taking a nap and enjoying.
I'm gonna go back to the soft.
I mean, I take naps in the
wow.
MRI. I'm usually, and when I'm getting my teeth cleaned, sometimes I'll fall asleep. Here you go. This is another a statement that you need to learn. Okay, you ready?
Yeah.
Oh wait. No wait.
请把我的内衣穿上。
Qingbao.
Okay, you ready?
Uh-huh.
请把我的内衣穿上。
It means put my underwear back on, please.
Please.
That's right.
I'll save it.
Oh, that's hilarious.
Wow.
Better stick
Yeah.
with boo how.
Well, I just think if you're going to be, I mean, massages are such an intimate thing anyway. It's always good to sort of know what's on the menu, but
Yeah.
it's hard when there's a language barrier. I
Right.
understand that. I was never a big massage person, but when I was at that retreat that I went to,
Mhm.
I tore my soleus muscle, which is
Oh.
one of the calf muscles. The first movement of the first exercise of the first day. And I was like, I'm not going to be that guy that's going, ow, my leg hurts. And so I did all of the things that we were doing that day and just in agony, but I was damned if I was going to show it. But that night I had a massage scheduled, and I had this big, well, I don't want to say big, but she was big boned. I mean, she was very strong woman named Marty. And
Oh, for God's sakes, throw Marty.
yeah, no, she was awesome. She was awesome. Marty, I will love Marty till the end of my days, because I told her what had
Husky
happened,
Marty.
and she said, well, she was just strong,
Yeah.
she's physically strong.
But,
And she said, do you mind if I use hot rocks on you? And you always see those pictures, but they're static. It just looks like people are laying there and they're just placing rocks on them and leaving them there.
Yeah.
And I said, sure. And she got out this rock and lubed it up and just went to town on my
Nice.
leg, just scraping it from the
Like
top to the bottom.
blading, yeah.
Yeah,
Yeah.
blading. That's what she was doing.
Gua
with it.
sha.
Yeah.
Is that what it's called?
It's gua sha, yeah.
Okay.
Blading.
And but she bladed the shit out of that leg, and I'll be damned if I didn't walk out of there with 90% pain relief.
Wow.
And then the
Awesome.
next day I did sort of a Western thing. I saw the physical therapist, and he dry needled me. He stuck acupuncture needles in, and then hooked me up to electricity. And I posted a video of that with my leg twitching with the electricity, twitch,
Mhm.
twitch. And then the rest of the time I was fine.
Hmm.
So don't
Nice.
shit on massage therapy. It really is real therapy if you get somebody that knows what they're doing.
Yeah.
And physical therapy, if you have an injury like that, I highly recommend physical therapy. People go, oh, I'm not going to do that. No, they really do great work.
Mhm.
Physical
Yeah.
therapists do great work.
Mhm.
So, and then there's a whole medical subspecialty based around that called physiatry, or physical medicine and rehab, which they have a problem, because when I say I'm going to send you to a physical medicine rehab physician, they say, well, I ain't going to no nursing home. It's like, no, that's the name of their specialty.
Mhm.
But anyway,
Mhm.
all right.
Hmm.
Very good. I had something else that we wanted to talk about. You guys been noticing these drug shortages?
Yes.
I mean, it's insane, right?
Yes.
I started saying, well, it feels like we're in a third world country, except I had a guy interview with us, a doctor who, if he comes to work with us, Mel B, you're going to really like him a lot. But he has 7 kids and they spent 4 years in Tanzania. He said, you don't know what third world is, you know? So okay, we're in a second world country when it comes to these drug shortages, because we have patients who need dronabinol. They have chemotherapy associated nausea, or they have wasting syndrome from their cancer, or they have HIV and they have wasting syndrome. And dronabinol is an FDA approved version of Delta 9 THC, and it is synthesized in the lab, so it's legal. It comes in 2.55 and 10 milligrams, so it's legal because it's a quantifiable amount. And it's legal in all 50 states, except now we can't get it. You can't get it anywhere.
Wow.
Nowhere can it be found. It's only made by one manufacturer. This is one of the problems in this country, is these things have gotten so consolidated. If the one manufacturer screws up with the FDA and the FDA shuts them down for quality reasons, then nobody gets anything. I mean, try to buy a resistor from a factory made in the United States. It's impossible. There's no such thing.
No.
It's all made in China.
Yeah.
So a lot of these pharmaceutical companies, you know, and one of the problems is, and I'm going to get shit for this, is that we don't allow them to make money. Now, Pfizer, obviously an exception, but you know, some of the prices that they can charge are actually less than what it costs them to make it. So they just go, fuck it, we're not going to do it. So, but anyway,
I think it'll be worse. I was at ASCO, the American College of Society or Clinical Society of Oncology, national conference 2 weeks ago. And a lot of drug development and clinical trials, especially surrounding gastric cancers and certain lung cancers, is happening in China. And they have really remarkable therapeutics that we really need. But I think the pipeline on getting those drugs actually here and approved here is going to be significantly delayed.
Well, can we not make some things here? I mean, I think we should be, if a company here comes up with something, yes, they should be able to sell it in other countries and they should be able to make a profit and all that stuff. And if it's made in Belgium or China or somewhere else, we should have access to it as well. There should be a global market for that stuff.
I've seen some nonprofits that are working on that, where drugs are available in the United States, but not necessarily in a European Union country. So certain nonprofits will work on that. And then the FDA has the early access program, fortunately, but it's a lot, and it delays patient care.
Why are we allowing these delays? That's the thing.
Yeah.
Is, you know, this Paul Abramowitz, he's a CEO of this ASHP. It's a, you know, don't worry about what it is, but he's a spokesperson. He's, you know, they track drug shortages. So some of the most worrying shortages involve generic sterile injectable medications, including cancer chemotherapy drugs and emergency medications stored in hospital crash carts and procedural areas. Come on.
Gets rationed between who's curative intent and who is not. Fortunately, we don't have to do that in our area, but it's certainly.
This is unnerving. This is really unnerving. And what's the injustice that I see in my practice is with the dronabinol shortage. We just go right over the line in Virginia. Virginia residents can just go to a dispensary. So they're okay. It's more expensive. Their insurance doesn't cover it, but they can get it. But their friends who live just over the border in Tennessee see their friends going to the dispensary, but they can't.
Right.
Now, the good news is that the DEA has recommended that marijuana be rescheduled from Schedule 1, meaning it's illegal, to Schedule 3.
Okay.
So it will be prescribable. The FDA can't approve it unless they change their rules, because they have certain rules about what they can approve, and you have to have a quantifiable ratio and a quantifiable amount, plus or minus a certain percentage. You can't do that with a plant. But it's going to be really interesting to see how this plays out, because all these places selling Delta 8 and all that stuff, they're going to knock them out of business when the pharmacists have to be the ones that dispense this stuff, because a Schedule 3 drug has to be dispensed by a pharmacist. So, but it'll be legal everywhere. So we'll see. Now the states still will have some say over it.
Yes.
States can have the right to take a Schedule 5 drug and make it Schedule 1 if they want to. You know, gabapentin is not a scheduled drug in every state,
Oh,
but
I didn't know
in
that.
Tennessee and Virginia, they rescheduled it to a Schedule 5 or whatever. So now it's a controlled substance. So, yeah, interesting.
We definitely see it.
Seems like there's some easier ways to go about these things.
Well, I'll tell you one thing. You know, I've become one of those people I used to make fun of. You know, I'm pushing lion's mane mushrooms on my patients and stuff like that for their neuropathic pain.
Right. Yeah. There are a lot of other options.
And reishi and all kinds of things.
Yeah.
Good.
There are a lot of other things out there that do work.
Yeah.
It just takes it takes a lot of the Western providers being okay with learning about these things and being okay with suggesting them and not prescribing them and saying, look, you know, there may not be perfect, you know, research on this, but we've seen some things, and I know some people that have done pretty well with taking these supplements or having these other treatments.
Well,
you know, and not feel bad about it, not feel like they're, you know.
My thing was always, if it's not going to do any harm,
Exactly.
it might do some good. But there is decent data on things like lion's mane extract. You don't want the powder; you want it extracted. The chitin in the body of the mushroom can prevent some absorption of some of the good stuff. So I just extract mine. I do an alcohol extraction, then I do a water extraction. And, you know, I've just got these bottles of lion's mane extract lying around, but you can buy it. You just buy it at Amazon.
Right.
And it's anecdotal N of one, you know. You and I recorded my final performance on the piano because my neuropathy had gotten so bad. I'm ready to re-record it and do the whole piece now. I only did 2/3 of it. I can really, I mean, it's amazing the difference. And I've suffered from this neuropathy for years, and alpha lipoic acid and glutamine and those kinds of things really helped a lot. But the lion's mane kind of pushed me over the finish line.
Isn't that wild?
So, and I used to make fun of people. Oh yeah, mushrooms, you know, go fuck yourself, you know. But now I'm that guy.
Yeah. Have you researched amygdalin at all?
Little bit.
Or apricot seed?
Yeah, a little. Well,
it scares me.
Yeah. Now Laetrile was developed from the apricot seed, and all the data I've seen on it is that not only is it not helpful, but it can be
quite harmful.
Yeah. But people back in the 70s, particularly, were going to Mexico to get Laetrile treatment because, frankly, at the time, the chemotherapy that we were doing and the quote unquote cobalt treatments and stuff were pretty barbaric.
Right.
I had a patient taking this over the counter, like, or Amazon delivery amygdalin.
Yeah.
And it essentially gets, when you take it through the GI tract, right? Not as IV, but when you take it through the GI tract, there's strong data that it gets metabolized into cyanide.
Right. It's
and
cyanogenic
this patient was
glycoside.
in fulminant liver failure.
Oh, wow.
Of course, it takes a long time to get cyanide levels back on people. And, we didn't even realize she was taking it. She was a metastatic breast patient. But anyway, it just really concerned me that this is on the market. You can purchase it.
Right.
Certainly for healthy people, you could probably process it and be okay. But for unhealthy people.
What I've said and I'm just looking at this amygdalin, natural cyanogenic glycoside occurring in the seeds of edible plants, bitter almonds, and peaches. It's medically interesting, but controversial, as it does have anti-cancer activity on one hand, but is also toxic because when the our body's enzyme degrade them, it produces hydrogen cyanide.
Yeah.
Which is, deadly. So these things are fascinating molecules that need to be studied. But it breaks my heart that people are in a situation where they feel like they have to go outside the medical system to get stuff. Kratom is a good example of that. Kratom is a fascinating molecule. It has mu-opioid receptor activity, just like morphine and hydrocodone or oxycodone, but also is an alkaloid. So it's got all sorts of, alkaloid type activity. And I have people writing me saying, hey, I was addicted to oxycodone and I got off of it using kratom. And, but now I'm addicted to kratom. or whatever, or some people have had some good successes with it, but it bothers me that people feel like they can't just go to the medical profession to get this help, that they have to go to like a head shop and just take their chances, and same thing with psilocybin for PTSD.
So effective, or can be.
Yes,
Yeah.
the data is good, and if you choose your patients correctly, and we will have it, but there are people out there with severe PTSD, and the drugs that we have and the talk therapy alone may not be enough. And so they're having to go buy magic mushrooms from Joe down the
And
road,
figure out how to microdose.
and right, and have to do it on their own, and they're on their own, and that's the part of it. I don't mean that I need them to come to me and let me bill them, but I just don't like it for people to be on their own trying to take care of this stuff because they're so desperate for relief and they can't get it.
And it's a population that should be like one of the forefronts of our attention.
Correct.
With the suicide rate being so high.
Correct.
So, man, I agree.
Yep.
Give thyself a bell.
All right.
Depressing.
That sucks.
All right. Anyway, okay, I'm off my soapbox. You want to take some questions?
Let's do it.
Yeah.
All right, let's do it.
Number one thing, don't take advice from some asshole on the radio.
All right. How about this one?
Hi,
Hi.
my name is Alexander. I'm calling because I would like to know if untreated allergies can cause nasal pharyngitis. Please let me know. Thank you.
Yeah, absolutely.
Mm-hmm.
Yeah. One of you guys, I've been talking enough. One of you guys want to take that?
Melby, you want to?
You're talking about post-nasal drip.
Yeah. And inflammation. You want to take it, Melby? Or?
Yeah, I mean, the answer is yes.
Yeah, so you get this like continuous
Yeah.
release of histamine. You get cobblestoning in the back of the throat, so inflammatory changes, hypersecretion,
Drainage, nausea, it all comes with it.
And there are many ways to treat it. I mean, other than just an antihistamine, a prescription
Just.
medicine. There are nasal sprays that you might find online, like Simply Herbals,
.net, yeah.
.net. Yes, that's an excellent nasal spray that's healthy for you. The nasal lavage, you can wash the crud out of your head, like Melby was probably remembering. And,
Never do again.
And speaking of Chinese, there are some old Chinese herbs that are pretty good for nasal stuff. Actually, I took
Like
some
what?
this morning.
Astragalus.
Astragalus is
God
one that I
damn
love.
you.
It's the best.
Astragalus.
It's the best. It's
So
the
I think the
best.
question would be: is it dangerous to not treat it? Right.
Right.
Well, it depends on how fucking miserable you want to be.
Well,
And
the
if you
question
can't
being,
breathe or
if
can't
you
breathe.
leave that inflammation alone, could it lead to head and neck
Right.
cancer or something like that? I don't think there's any
Or just
evidence of that.
infection, secondary infections.
Post-nasal drip, it just wears
Annoying.
it just wears away the mucous membrane, and when it's exposed, then it gets inflamed and it gets painful. And so yes, absolutely. So you want to get that treated. And there's lots of, if you have chronic post-nasal drip, there may be something else going on in there. You could have a nasal polyp or a concha bullosa or something like that. So let somebody look up there. Your primary care should be taking out a speculum and actually looking in your nose with a light. And if they're not doing that, get them to send you to an ear, nose, and throat doctor and get that looked at. Okay. But sometimes just a little Flonase, a little nasal steroid will take care of it. What are you going to say, Melby? You just got
Just
that look
thinking
in your
about
face.
putting things up my nose.
Oh yeah, she loves
No,
it.
she hates that.
My
Yeah.
very favorite thing.
Right. She hates it so much that we had the inventor of the Navage on our show, and we convinced her to try a Navage. Yeah, we got her
I
own
did
unit.
not puke.
You didn't?
I
Good
did
job.
not. No,
Oh, she
And it
wanted
felt-
to.
That's what she said.
I was drinking tequila. I
She
had
wanted to.
Get some liquid courage.
And it felt good though, right?
It did. I've never been so opened up in my life, and never since.
Yeah.
But never done